Hi, my name is Maddie, and I've checked with the doctor's orders to make sure that there's an order for the insertion of the Foley catheter. And I go into the supply room and I grab the right size, which is the 16 French, and I will go into the patient's room and introduce myself, and I will identify the patient by their name and their date of birth. Let's use their name band. And before I do anything with the catheter, I will perform period cares on the patient. And this is the fenestrative drape, and we use that on the males. I'm not going to use it today. Open my loop, scoop them out. I'm going to take out the iodine swabs. I'm hooking this up to make sure that when I inject this in, that it makes a balloon. It does. I'm going to take this off carefully, making sure that I maintain control of it. I'm going to take my non-dominant hand and I'm going to spray the labia. I'm going to take one swab, come around the sterile field, and go on front to back from one side. I'm going to take another one going around, and then go on the other side, front to back. I'm going to take the last one going from front to back as well, going down the middle. Now while maintaining it, I'm going to take the catheter, and I'm going to lube it up. In an upward motion. To insert the catheter. And it will go in 3 to 4 inches. Once I see urine come out, I'm going to go in 1 more inch. And then with that hand, I'm going to grab onto the catheter to make sure that it stays in. And I'm going to inflate the catheter 5 millimeters. And then once I have done that, I'm going to gently tug on this to make sure that it stays in. And then while inflating the balloon, I'm going to be checking the patient's face for any facial grimacing or comments of pain. And if so, that means that I'm not in the bladder, so I will go in 1 more inch. So then while that's in, I'm going to take this hand, I'm going to disconnect this. Take my face off. Make sure I cover up the patient as soon as I can. And making sure that the tubing is not clamped. I'm going to take the Y end of this and attach attach it. By attaching it to the Y, it just makes this more movable so it doesn't pull onto the patient. I'm going to make sure that the tubing is coiled onto the bed. And I'm going to hook this on a non-movable part on the bed. I will cover the patient. Now I'm going to make sure that the patient is comfortable if they're not in any pain.